Hi, I'm Katherine Petrarca, and I will be doing my physical assessment for my midterm. Today I have Mr. Spencer.
Hello.
How are you doing today?
Good.
Okay, can you tell me your full name?
Sean Spencer.
And do you know where you're at?
The VA Long Beach.
And can you tell me what time it is?
2 o'clock.
And why are we here today?
For my annual physical.
Okay, and I can tell that you're dressed very appropriately for age and weather. Your hair is very well groomed, very well mannered.
Thank you.
Okay, I'm going to now assess for your memory, attention, and speech pattern. So first off, let's talk about short-term memory.
Okay.
Can you tell me how did you get here today?
I drove.
Okay, and what did you have for lunch?
A sandwich.
Okay, long-term memory. How about who holds 16 Olympic medals?
That would be Michael Phelps.
Great. And for attention span, can you please spell the word world backwards?
DLROW.
Great. So your speech pattern is normal, of rhythm, clear, and very concise. Okay? Next, earlier we took your vital signs and we recorded them, so I just want to go over them with you. So your height was 5'5", your weight was 185 pounds, and your BMI was 30.78, which is a normal range. Your temperature was 98.6, respiration 20, heart rate was 80, blood pressure was 118/74, and your pulse ox was 98% in room air. And you did indicate that you weren't in any pain right now.
Not at the moment, no.
Okay, great. So I'm going to go ahead and assess your skin. Overall, you have uniformed skin tone with which is light brown with pink undertones. There's no jaundice noted. Very consistent with your ethnicity. Do you have any skin conditions?
Not that I know of, no.
Have there been any skin changes recently?
No.
Great. I will be examining his hair and nails throughout the exam, and we'll continue assessing his skin. Before conducting the physical exam, I washed my hands. So I'm going to start with his head. So his head is normal cephalic, smooth, and symmetrical. No lumps or deformities noted. Any tenderness while I was palpating?
No.
Okay. Now I'm going to check your maxillary sinuses and your frontal sinuses. Any pain or tenderness?
No.
Okay. Next, I'm going to go ahead and check for his lymph nodes, starting with occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior clavicular, postclavicular, and supraclavicular. Any pain?
None.
Great. Now I would like you to, I'm going to check your facial expressions. Can I first have you smile, frown, puff out your cheeks, and wrinkle that forehead. Okay. So his cranial nerve, facial cranial nerves are intact. Next, I'm going to check his eyes. Can you blink for me? Symmetrical in blink. Conjunctiva is pink with small vessels noted. Sclera is white. Cornea is clear, smooth, and moist. Cornea reflection is equal at midpoint. Pupils are 4 millimeters in size and round. Reactive to light. Next I'm going to check for accommodation. Please take a look at here. Now look away and look back. Good accommodation noted. So pupils are equal, round, responsive to light, and accommodation. Next I'm going to do your Snellen eye chart. So if you could cover one eye And read line 7 for me.
FELOPZD.
And cover the other eye. And read line 7 backwards.
DZPOLEF.
Good. 20/20 bilaterally. Next, we're going to do the near vision. If you can take a look at that and read this line for me.
63925ME3.
Good. Cranial nerve 2 is intact. Next, I'm going to check corneal reflection. Good. Intact. Next, I'm going to check for eye movement. Follow this light tip of this pen without moving your head. Good. No nystagmus noted. Next, I'm going to check your peripheral vision. Tell me when you can see my fingers. Look straight ahead.
Okay, I see them.
Good. Optic nerve intact. So in inspecting your ears are upright and symmetrical. The color is uniformed, equal in size, and similar in appearance. Okay. They're smooth and no nodules noted, and no drainage noted. I'm going to check for your hearing. Can you hear this?
Yes. Yes.
Good. Next, I want you to tell me if you can hear the vibrations in both sides.
Yes.
Good. Can you sit up for me? Next, I want you to tell me when the vibration stops.
Okay.
Also, again, when the vibration stops.
Okay.
I would do this bilaterally, and this indicates that air conduction is greater than bone conduction. Now, for your nose, can you hold one nostril down and sniff on the other side? Good. So the nares are patent. I'm just going to take a look. The mucosa is pink and moist. No drainage noted. And next, I would like you to close your eyes and tell me what you smell.
Alcohol.
Good. So, sensory of smell is intact. Okay, so your lips are pink, asymmetrical, but intact. Can you open your mouth for me? Okay, so your hard palate is firm with rugae and pink. Soft palate is moist, pink, and spongy. Buccomucosa is pink and moist. No lesions noted. Okay, can you stick out your tongue for me? The tongue is midline, moist, and saliva is noted. Okay, let me take a look at your tonsils. Unable to see tonsils. Positive for gag reflex. Okay, one more time. And can you say "ah" for me? Uvula is midline and movement on phonation. Okay, next I'm going to test for your taste. Stick out your tongue. What do you taste there?
Sweet.
Okay, next. All the way back here. What do you taste there?
Sour.
Good. Next I would like to test your muscles of your cheek. If I need you to protrude your tongue to the side. Very good. Oh, excuse me.
Okay.
Very good. Intact. Next, I'd like to do neck range of motion. Can I have your chin to your chest? Now look up at the ceiling. Turn your head to the left. And then to your right. Okay, look straight at me. So trachea is midline. Next, I'm going to check your thyroid. Can I have you swallow? Any pain or tenderness?
No.
Okay, no masses noted. Next, I would like to check your muscles. Can you shrug your shoulders for me? Good. And then what I want you to do is turn your head against my hand. Good. And on this side. Good. The neck muscles are intact. In inspecting his lungs, I'm looking at his thorax. It is symmetrical, firm in shape, elastic in motion. Skin is consistent with the rest of the body. His anterior, posterior to transverse is ratio is 1 to 2. Here. Can you lean forward? Thank you. The vertebral column, no deformities noted, no abnormalities in curvature. Next, I'm going to check for tactile primitives. I need you to say 99.
99.
Again.
99.
One more time.
99.
Equal in Renaissance. For expansion, can you take a deep breath for me? Expands within 2 to 3 inches, which is normal. Lung tones. Equal in Renaissance. Take a deep breath for me. No advantageous breath sounds noted. One more time, take a deep breath. And last one. No advantageous breath sounds noted. I'm checking the chest for thrills. No thrills noted. PMI is at the 4th intercostal space, midclavicular. I feel short, gentle taps. I'm going to auscultate for heart sounds. Aortic, pulmonic, Erb's point, tricuspid, mitral. Again, aortic, pulmonic, Erb's point, tricuspid, mitral. No murmurs noted. S1 heard loudest at the apex. S2 is heard at the base. Checking for carotid bruits. No bruits noted.